Hello, I'm June Thompson. The following dramatization shows a patient and a son in various scenarios interacting with staff. Observe each scenario closely to be able to answer questions later about how these staff members may improve their care and service by practicing appropriate cultural competence. Let's follow the patient, Jean-Pierre, a Haitian male, and his son to see their perspective of the care and service provided.
Can I help you?
Yes, my father's here for a procedure, Jean-Pierre.
Jean-Pierre. I'll need your ID and insurance card, please.
Ou gen carte identification avec assurance carte?
Yes, Mr. Jean-Pierre, 71 years old, African-American, here for a renal biopsy, correct?
Yes, but my father's Haitian.
What's the difference? Just have a seat right over there, please.
Let's get this done quickly so I can go on break.
Mr. Pierre, my name is Nancy and we're here to complete the nursing assessment.
Il dit il va demander quelques questions. Yeah, my father doesn't speak English, but I can translate.
Actually, we need an official medical translation.
Sure, you can translate. What's the difference as long as we get out of here faster? Can you ask Papi if he has any allergies?
Est-ce que vous grippez?
No.
No, he said he had no allergies.
Mais pour qui ça, je donne la siffler sous moi comme ça, hein? C'est mal de faire ça. Dites ça pour moi, non?
Papa, il va pas mieux que ça. Excuse me, sir. Yeah. Can you stop whistling? In Haiti, it's disrespectful to whistle in front of elders.
My mistake.
Mr. Pierre, you need to leave your oxygen on. Mr. Pierre,
What's going on?
your father won't keep his mask on.
Pour qui ça retire?
Pas besoin. Je sens bien pourquoi mourir. Dites ça moi.
He said he's fine. My father thinks that oxygen is for people that are really sick. Many Haitians think that.
That may be, but here it's not an option. He needs to wear the oxygen.
The doctor said your father should be discharged later this evening.
Oh, that's great. Il dit tout bas, ok, nous ka quitter à soir.
Oh, ok. Mais dis pour même grand goût, so capot ton petit bouillon sur la cala moi soya.
My father said if we can bring some stew from home, would that be all right?
Let me check, okay?
Okay, thank you.
Hey, Betty. Mr. Pierre wants to know if we could eat food from home.
Are you kidding? Tell him no.
Why? On his chart, there's no diet restrictions.
Really, Nance? Do you want the entire floor to smell like curry?
Oh!
Papa, ça again.
Douleur après mon corps.
Nurse, can you please come help my father? He's still in pain.
Please do something. Nurse, can you please come to the room?
Are you going to answer him?
This is the 4th time he's complained. I told him he needs to wait for the medication to kick in.
Are you sure? Because he...
Listen, Nance, people of this culture, they're babies when it comes to pain. You just gotta give him more time.
Papa, okay? Ça again. Papa, again douleur? Papa. Papa, levez. Allô, papa, parlez avec him. Nurse, I think my father passed out. Parlez avec him, levez, papa. Papa, ça again. Parlez avec him. Réponds, papa. Papa, levez.
Excuse me. Sir, are you okay?
What's going on? The patient's been complaining of pain for the past half hour.
I told him to wait for the medication to kick in.
Didn't you take any vital signs?
There's no response, but there's a pulse.
I'm calling Code Rescue. Hello? We have a Code Rescue.
What's the deal? Can we leave when he wakes up?
Unfortunately, with the change in your father's condition, we'll have to keep him here overnight for observation.
A whole night in this place? Are you serious? I can't believe this.
I'm sorry.
What you just saw is the wrong way for healthcare professionals to treat patients of a different culture. The lack of cultural sensitivity caused dissatisfaction to the patient and the family and compromised patient safety. Now we're going to see the same scenarios, but this time the healthcare team will provide appropriate cultural sensitivity and competence to the patient and his family.
Good morning, my name is Jacqueline. How can I help you?
Yes, how you doing? My father's here for a procedure, Jean-Pierre.
Yes, Mr. Jean-Pierre, we were expecting you. 71 years old, African-American, here for renal biopsy, correct?
Yes, but my father's Haitian.
My mistake. I'll update the system now. Can I have his picture ID and insurance card, please?
Vous avez une identification Katou avec assurance Katou? My father doesn't speak English.
Not a problem, sir. We'll take great care of him. And we can provide translation services if needed. In what language would he prefer to receive his healthcare information and his discharge instructions?
Creole, please.
Sure. The registration will take about 15 minutes. You guys can have a seat right over there, and we'll be with you to verify his information, and then your father will be escorted to his room.
Thank you very much.
Thank you.
Appreciate it. Take care of him.
Good morning. Good morning. My name is Betty, and I'll be your nurse for today. This is Nancy, your clinical partner. Can you please confirm your name and birthday?
My father doesn't speak English, but his name is Jean-Pierre. He was born August 17th, 1933.
Thank you. We're here to complete your nursing assessment. I've been a nurse for over 12 years, so you're in good hands. Give me a moment to get the translation phone.
I can translate.
Actually, we need an official medical translator.
We can use a room phone.
Well, why can't I translate?
We appreciate your help, but for your father's safety, we use medical translation services. After we're finished, we'll take your father to have his procedure done.
I guess that makes sense.
Mais pour qui ça jeune homme a sifflé sous moi comme ça, hein? C'est mal élevé ça, dis ça moi non.
Papa, il va compte mieux que ça. Excuse me, sir.
Yes.
Can you stop whistling? In Haiti, it's disrespectful to whistle in front of elders.
Oh, I'm so sorry. I wasn't aware. I probably shouldn't be whistling here anyway. Please tell him I apologize.
Papa, Lydie pardonnez.
Okay.
Thank you, sir.
Of course.
Mr. Pierre? Mr. Pierre? Mr. Pierre, you need to leave your oxygen on. Mr. Pierre?
What's going on?
Your father won't keep his mask on.
Pour qui ça retire?
Pas besoin. Me senti bien pourquoi mourir. Dis ça moi.
He said he's fine. My father thinks that oxygen is for people that are really sick. Many Haitians think that.
Okay, I understand his concern. It's only temporary because of the sedation. How about I reapply the oxygen, and as soon as I can take it off, I will, okay?
Li dit que l'a quitté temporairement kourounia parce que yo ba ou anesthésie.
Ah, okay. Jill, merci.
Okay, Mr. Pierre, I'm just gonna reapply your oxygen. You need this just a little bit longer, and I'll take it off as soon as I can.
Thank you very much.
Okay.
Il dit tout bas, ok, nous ka quitter à soir.
Oh, ok. Mais dis pour même grand goût, so capot ton petit bouillon sur la calamre à soya.
My father said if we can bring some stew from home, would that be all right?
Let me check, okay?
Okay, thank you.
Hey, Betty. Mr. Pierre in room 422 wants to know if his son could bring food from home. Is that okay?
Well, I don't see any diet restrictions. Tell him to go ahead.
Okay, great.
Thank you. My father will be very happy. Mr. Pierre, I understand that you're in pain? Yes,
Ou dit ki mwen plek douleur.
he's in a lot of pain, Doc.
I'm going to check your surgical site. We need a CT scan stat. We need to rule out internal bleeding.
Okay. Yes, we're going to be bringing our patient down for a CT scan.
Hello.
Hello.
How are you?
Good. What's the deal? Are we gonna be able to leave after when my father awakes?
Unfortunately, with the change in your father's condition, we'll have to keep him here overnight for observation.
Yo di yo pral kembe ou isi, I swear.
Kebe maswe.
Oui.
Bon, mba gen problem. Depi m jwen bouyon mwen, mba gen problem.
My father says that's fine as long as he has his hot stew. Can I stay also?
Of course. We encourage the family to stay as much as possible.
Thank you.
Okay, I'll see you later, okay?
Ok, see you.
Papa, nou ba la pharmacy apre sa, okay?
Ok, alright.
Well, I hope you enjoyed your care here.
Oh, everybody here was great. I mean, my father's really happy with his care.
That's good.
Hi. I was just finishing up my rounding. I'm so glad I ran into you three. How are you today?
I'm great. I was just saying how my father had excellent care here.
I'm so glad to hear that. I'll be sure to send thank you notes to the staff.
Oh, thank you.
And thank you, Mr. Pierre, for coming to Baptist Health.
My father doesn't speak English.
Oh, so how do you say thank you in Creole?
Merci.
Merci, Mr. Pierre.
Merci. Merci bien.
Thank you. Have a great
Thank you
afternoon.
very much.
Bye-bye.
It's good to know that you enjoyed your care here. That means a lot to us.
As you've just seen, we provided effective communication, cultural competency, and patient-centered care. This increases the quality of care and improves patient satisfaction, outcomes, and safety while building trust with patients and their families. Thank you for your commitment to the Baptist Health Way and providing the best cultural competent care and service to our patients and their families.